Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Breast implants pose challenges during a mammogram. Should women tell the technician before the mammogram is started?
Oh, absolutely. But even before we get to that, there are two types of breast implant broadly. One is a saline implant and the other is a silicone implant. As the name implies, saline contains saline or water and silicone contains silicone gel. Silicone gel poses an even greater challenge when it comes to interpreting mammograms.
I've heard that the X-rays in mammograms cannot go through silicone or saline implants. How accurate will the mammogram be for the breast tissue under them?
Breast implants are two types. One that is placed right under the gland and the other that is placed behind the muscle, which is called the retropectoral implants. So when the implant is placed right under the gland, it obviously obscures a lot of the breast tissue. It doesn't really make a difference whether it is silicone or saline. Silicone implants are denser and therefore tend to obscure a lot more of the breast tissue while a mammogram is done. And if I may add, in people with implants, we do additional views, one with the implant in place and one with the implant displaced, so that we can get to see the maximum amount of breast tissue.
Are women at higher risk for breast cancer because of a breast implant?
Implants do not increase the risk of breast cancer. But what really happens is, since implants can obscure the breast tissue, there may be a delay in the diagnosis of breast cancer. In fact, there was a study from Canada in 2013 which actually said that the cancers found in people with implants are at a higher stage simply because it takes a longer time to find these cancers.
Could implants actually hide cancer during a mammogram?
Oh, absolutely, they could. And that's why in people with implants, when we find a cancer, they're normally slightly larger than you would in a woman without an implant.
Is a 3D mammogram better than a 2D for women with implants?
Implant per se does not make a difference. Whether a 2D or a 3D, what applies to a normal breast is what would apply to an implant. It makes no difference because it's the breast tissue that we are evaluating, not the implant on a mammogram.
Will the mammogram exam damage an implant?
An implant that is older does have a higher chance of damage. Per se, a mammogram has a very low probability of damaging an implant, and that incidence is extremely uncommon, but yes, it can damage an implant.